Hi, I'm Dr. Leon Caldwell, Senior Director for Health Equity Strategy and Innovation at the American Hospital Association. I am joined, and I'll let my esteemed panelists here introduce themselves, for a very special conversation, I think a very unique conversation we'll have, which is really, I would say, the ground zero for our modern movement, social justice. And the perspective we want to elicit here is around the role of hospitals and healthcare in one that movement, but also as leaders and the relationships that came afterwards and what happened afterwards in the aftermath, but not just get stuck in the aftermath, but what was people doing before? We really want to have that conversation. So I'm going to start from my far right and just kind of come around clockwise with just a brief introduction.
Yeah, good morning. Lisa Shannon. I'm President and CEO of Allina Health.
Thank you, Lisa.
Mark Gorlick. I'm President and CEO of Children's Minnesota.
Good morning, James Burrows, SVP at Children's Minnesota and Chief Equity Inclusion Officer.
I'm Mark Welton. I'm the CMO for M Health Fairview.
Taj Mustafa. I'm the Chief of Equity Strategy for M Health Fairview.
Good morning, Jackie Thomas Hall. I'm the Vice President and Chief Diversity, Equity, Inclusion, and Belonging at Allina Health.
So as you can see, this is a pretty unique table, right? And we tried to set a table for a conversation that we haven't seen happen, which is post, let's say, the George Floyd effect, and equity kind of rising up through the government and through most of our communities, the conversation between the CEO and the Chief Equity Officer. It's a unique relationship. It's particularly in crisis, as you know, many of these things came about. But what's that relationship like? What's the work like? And this is kind of the environment that we want to, and the conversation we want to have. So let's just go back and center the beginnings of this to on May 25th, 2020. We have the murder of George Floyd in the streets of Minneapolis. For those who were not there, right, watching it on television, what was it like? Help the conversation get grounded in that moment.
You mentioned that date. It's really heavy. Our offices are just mere blocks from where his murder occurred, and we were in the midst of COVID. And we, in many ways, had layering of crises, and we thought it couldn't get worse, and then it did. And it got a lot worse. And we had the response of community in our neighborhood and around our campus. And there were a lot of threats to facility equipment. We had a clinic real nearby. And it was a very heavy time for our workforce, for our community. It certainly created in us a catalyst for more action. Not action, but more action. And I know others felt similarly. It was almost unreal to be there and to witness it.
And I'll follow up just to say, a couple of things as we think about where we were on our DEI and B journey. I've been with the organization just a couple of years, actually a year and a half. And we were focusing on, from an internal perspective, what we needed to do. And when this event happened, I remember saying to myself, oh my God, what did I just see on television, right? And it compelled me to send our current CEO an email. And I told my husband, I said, well, I'm probably going to lose my job, but I've got to be real. I got to tell her what it means to be a woman of color, to be a mother, to be a grandmother of Black men, and the impact that it is having on me. And so I wrote this letter and I sent it 7 o'clock Monday night, and 7:30 that morning, Penny, who was our previous CEO, was on my phone. And she's like, I need to talk to you, and you need to talk to all of our leaders. And I'm like, I'm not ready. But it ended up being one of the most vulnerable and one of the most sensitive conversations that leaders had. And it created a lot of, I don't know what I need to be doing, but we need to do something, individually and collectively.
The vulnerability for me hits home because when it happened, my first thought was deja vu. So I don't want to forget about the Jamar Clarks, Philando Castile, and other black and brown people that were killed at the hands of police in Minnesota. And when I saw it, I knew that my CEO had to see it as well. So I actually called Mark and said, you got to watch this, because he hadn't watched it. I said, you got to watch it. It's going to be tough, but I want you to see it before we start to do anything, before we start to make any statements or what we want to do. And for me, that deja vu was like, okay, we have to make sure that the community and our hospital systems and our patients and families and our staff know that we care. So they can't just see it and say, you know, we saw it and that's it. So we ended up making a statement, Mark, myself, our CHRO, Lauren, Kathy, and our marketing comms team put together a statement. And the statement wasn't about us, it was about what you just saw, the tragedy of what you just saw, how we don't want that to be representative of Minnesota and our healthcare system, and how we have to do better. So it was a catalyst for us kind of moving the ball forward in my mind.
So I've, I think, a slightly different perspective because I wasn't actually in leadership at the time when that happened. I was mostly working as a hospitalist, seeing a lot of COVID patients day in and day out. And what I saw as a frontline provider was really the stark difference between the experience of people of color in the frontline space and the white providers in the frontline space. And when you talked about the date, because a lot of times when we talk about the murder of George Floyd, we're talking about the months surrounding it and not the day itself. And on that day, there was a difference. And it was a difference in experience, right? I remember some of us just in despair. And others where it was a little bit less proximal to their experience or their community or their friends or family that were like, that's awful, but you know, we have work in front of us, and you do, and you still have to, you know, turn patients, and you still have to adjust ventilators, and but it was just a stark difference of an experience and a conversation that we really hadn't had at the front lines. And so I think that day itself to me brings back a different vision of the time than the months surrounding it. Because the months surrounding it were more of a response, and I think a joining together in that conversation, and quite frankly, a joining together in the despair that hadn't really been shared, I don't think, before that time.
I was in the leadership team at the time, and I love your word about deja vu, because I was in Los Angeles during Rodney King. I was at UCLA, and I was driving back streets to get to the hospital safely because of what was going on around us. And when it happened, it was very much like that to me. And our leadership team, though, said, people are focusing on doing and getting out and doing, and our leaders said, we just have to listen. We're not doing or saying anything, we're listening. And I really appreciated that, because you step in, you want to step in and act and go do something. It's like, who am I to say what we should be doing? We need to go listen to see what will be making a difference. And so that really was the very beginning of all the things that we then ended up doing after we listened to people and asked people to help us lead us to where we needed to be.
You know, one of the big things for me about that day, we've been doing things around health equity and diversity and inclusion for quite some time. I think, you know, and James and I have talked about this. For James, it was always something that was more personal. For me, it was something that was maybe more intellectual. I know this is the right thing to do. I've seen the data. I know all the statistics about disparities. I've seen it in my career. But what happened on May 25th, 2020 was it became personal for everybody. Because being right there down the block from where George Floyd was killed, attending the rallies, being there, seeing the video, talking to people, doing all that listening, it became personal for every single person in our health system in a way that I think it hadn't been before.
And one of the things that, as you think about listening, what does listening do? It creates an opportunity for you to step back and truly try and understand someone else's experience. We not only hosted multiple listening sessions, but Lisa really began to focus on what does that mean from a physician perspective? What does that mean from an employee, a leader perspective? And we specifically said, we need to hear from our Black and brown employees. And one of the things, and Lisa can talk a little bit about it, but what we heard differently is that for the first time, as leaders in our organization, leading people of color, one of the things that we learned is that we don't think, or these employees were saying, I work alongside you every day, but when it came to this particular incident, people of color said, no one checked in on me. No one said, how are you doing? What's happening? How can I help you? And we heard that loud and clear and immediately went into action and said, how do we make sure that our employees understand that this is something that we know is personal for many of you and we need to check in on you? And Lisa really was the catalyst to say we need to connect and we need to lean in and we need to lean in and be very focused on the individual that we're talking to. This is not just check in and go. We really need to check in and really make sure that they're okay.
So I'm hearing a lot of really key words. Vulnerability, listening is one of those really critical ones. But I'm also hearing this action word of catalyst, right? Like seemed like the jump start of more. So tell me about that more.
I think for me, I'm torn. So George Floyd's murder should not have been anybody's catalyst for doing anything differently around DEI. DEI is a business initiative. It's great for our health equity disparities to address. It's great to have diversity in our workforce. So I was torn between, okay, I don't want this to be a catalyst for our leadership team. I want you to sit in it. And I literally told them that. I said, sit with the discomfort of seeing a man murdered on TV who looks like a lot of your population that you serve and also your staff, and then just get uncomfortable. Don't say we're gonna have more recruits, more diversity in the workforce. I don't think I was reporting to Mark at the time. I don't think I was a part of the C-suite at that time, but that eventually changed. But it was what I asked him to do and others, just sit in it. Because I wanted them to feel more so than do. Feel the pain of many, many people who don't look like you, who are saying, you don't hear me, you don't see me, the silence is deafening. And then once you do that, feel it some more. And then feel it from a kid's level. We treat kids, pediatrics, we treating kids. So imagine what a kid feels like looking at that on TV. Imagine what Darnella Frazier feels like having taped that at 12 years old. The evidence is taped by a 12-year-old. Imagine those things and that pain. So for me, I tried to take it away from the catalyst for doing more as far as the diversity work, but I did want to say, let's do more to listen to our employees, see what those pains are, because as you know, from there were a lot more tragedies that happened in different communities within our ERG, so that listening skill is important. I think the other thing for me was to make sure we are hearing what community says. It's one thing to listen, then it's one thing to do what you want to do anyway after you've listened. So I said, listen to what community says, and let's try to figure it out. If we don't get it right the first time, let's try again and make sure community has a staunch position at the table at all times, not just when a tragedy happens.
Yeah. And for us, I think listening led us to really understanding our gaps in our own understanding of this work. Yes, the organization has always done some work around gathering data, particularly from a provider perspective, looking at different populations. So we had that history. But what we didn't have was an opportunity for leaders to say, and how is it making a difference for you? This is not your population. This is not your community, but it's the community that we serve. And so I always talk about this work being inside out. If I am in an organization and my leader says, Jackie, go do this, I'm gonna do it, right? Doesn't necessarily mean that I make a connection to it. And for this work to have meaning and to have impact, each individual has to really think about what does this mean for them? So we went on our journey around understanding cultural competence. What does that mean for an organization the size of Allina? We engaged our board early on to have these discussions, to go through an assessment to talk about their current state of understanding cultural competency and bias. Then we began to talk to our leaders and others. So we wanted to make sure that we focused on this as a business. This is a top-down approach. We can make sure that we are doing work within our organization from a program perspective, but those programs will go nowhere if we don't have leaders that are shifting their mindset. And so as an organization, I think more so, George Floyd created an opportunity for us to stop. Our first words wasn't DEI and B, it was recovery. And Lisa led that effort to really begin to think about how do we help our community recover. And what we saw as we began to have these conversations, it was a nice coming together of our recovery efforts in our community and our DEI and B efforts.
I love that point, Jackie, because if I think about what a catalyst does in a chemical reaction, right, it lowers the barrier to the reaction happening. I don't know that there's a lot that we're doing now that we weren't already doing or had planned on doing as part of our strategy, starting back since I started in my role. But when I think about what the barriers were, one was not so much that people internally were opposed to it, but they didn't necessarily internalize why this was a really important thing. And that became a lot harder to do after George Floyd's very public murder. So there was a lot more, it became, again, more personal for everybody because of all the listening we did. And so that facilitated us getting that work done. And the second was, while others were probably doing these things also, we weren't as aware of it because they weren't as visible. And so that barrier of you can't do this alone was lowered because all of a sudden we all became very acutely aware of what all our partners in the community were doing, and we could try to do that together. So I think in many ways that it was a catalyst in the truest sense, and that enabled us to do what we wanted to do all along, but couldn't do as effectively. And I think it's really spurred a lot.
Yeah, maybe to add to, you asked a question on how did it change the relationship, paraphrasing, between the Chief Diversity Equity Officer and the CEO. And that relationship was always important. And yet when I think about the work, Jackie, we've done with the board, the work we've done with our leadership team, the formation of a CEO Council for Diversity, Equity, Inclusion, and then last year added belonging to that work, we really did take an approach to lift what we'd already been doing, but to personalize it to the various roles we play in community. First, inside out, as an employer, as we think about our workforce, as a patient care provider, as a purchaser, and as we think about where we invest and how do we allocate some real dollars toward in community and impact investing, as we call it. And as we think about, where do we show up in community and what do we need to do there? So I do think all of those things brought the work together in a way that was really about how we show up.
As you were talking about, right, both of you, about how it wasn't, right, there were all these things happening and we were all doing them separately, but I think that work was also happening separately within the organization. So we have this robust community advancement division. We'd been a member of Healthcare Anchor Network for a long time, right? That work was happening separate from the work in disparity reduction, quality, and safety, which was happening separate from the work in employee diversity, equity, and inclusion. And I think what that moment did, and then the months following the listing, right? Like I think of, for myself, it was evident that we had disparate rates of morbidity and mortality in Black and brown communities from COVID. Frontline providers knew it. We saw it. I mean, we could see it in our patient panels, right? And to tie that back then to what it means in terms of workforce, what it means in terms of community investment and outreach immunization clinics, right? What it means in terms of allocation of our antiviral therapies as they were coming out for different communities, right? And so I think understanding how all of those things are tied together, and our work needs to involve all of those things, right? As long as we have, algorithms for clinical care that are based on race due to flawed research, we can't, right? No matter how many community outreach sessions we do, if we're providing disparate care in our walls, it doesn't matter. We have to tackle it all at once.
I'd just like to add to the comments. I think the difference for me and our organization, other than creating all the different infrastructure that we did, it reminds me of quality and safety. When we started quality in the early 2000s, it was somebody else's work. There was a quality committee that did quality, and everybody else was running around. And before this, diversity, equity, inclusion, and belonging was somebody was doing it, but it wasn't what I was necessarily thinking about in every decision. And I really think that we don't do it 100%, but I really think we make a conscious effort to say, what impact will this decision have on that? Will it be positive, negative, neutral? So it's something we consider as we go through our leadership and frontline decisions. And I think that's a difference than before this.
I think for me, Leon, some of this resonates, but some of it doesn't. Because George Floyd was killed by police on the corner of Chicago and 31st, I believe. So the thing to do was to address police violence. That's what we should have been doing. We did a lot of other activities around health equity, diversity, inclusion, but the thing that we still are in the process of doing is using our corporate voices to say, that's wrong. That's a health equity, social determinant of health issue that we have to address, and we have to go to the legislature, we have to go to the federal government and say, we need to pass the George Floyd Act in Congress. We need to have police reform in Minnesota. And I think that's some of the things we did do. So there's an organization called the Minnesota Business Coalition for Racial Equity, and they started soon after George Floyd was murdered. And it was a lot of our companies, and we said we want to do things differently. So we looked at public policy to say, what can we do to change the rules around policing? What can we do to make sure that the Derek Chauvins of the world don't get back put on the force after they do something like this to people if they have a bad track record? So I think some of that, what we did, was external to our expertise. We didn't know how to do that. Our policy people were focused on healthcare, typically. Now we say, oh, go talk about criminal justice and reform. So we did some of those things through the NBCRE, and we're still pushing ourselves to do more there as well, because I think sometimes DEI gets the bucket to be like, oh, something bad happens in the community of people of color, go do the DEI stuff better, or go have another celebration, or go have another this. And it's like, well, no, that's not the issue. Let's still talk about the issue and what the issue is as well. Similar to our hiring, when people said, well, James, we want you to hire more people of color, they weren't just talking about in entry-level positions. They wanted to see the C-suite look differently. They wanted to see our physicians and our nurses look differently. They wanted to see the contact with the patients look differently. So I think we have to be mindful of, I think we are, that the solution, once we listen, has to be tied to what the problem is. And we always talk about, root cause analysis and root cause problem solving. We have to do more of that. 'Cause sometimes we put it on the back of the CDO person or the chief diversity or chief equity person, like, go figure something out and do that and make us happy. But no, that's not gonna work.
I resonate with that because, again, one of the things that I think we have to acknowledge is that this is not comfortable work for everyone, right? I come into an organization and I want to demonstrate my expertise. Now you're talking about getting into areas of social justice. Not sure I've ever had a conversation about it. So we were asking people to do things to step out of their comfort zone, right? And so as an organization, I think what we wanted to do is to say, we have a public policy area. We have people in our organization that is doing this work. How do we get them comfortable enough to join different organizations, to create that point of view for Alina, but also to say, we expect this, right? And so it's not, let's bring Jackie to the table. Let's see who within our organization owns this work, and let's make sure that they are comfortable enough in saying, this is our point of view, and I have a perspective that not only resonates with Alina, but with me. And so I think that is a evolution. It's a maturity. We are getting there. We're not quite there yet, but we absolutely know the importance of being a part of public issues. Our safety and security area, when I think about where we are today, we have matured. We are bringing in experts in this area so that we understand where our largest hospital, Abbott Northwestern, sits.
So here's a question. This is a setup for smiles and giggles. So what sets a chief equity and diversity officer and belonging officer for success from the CEO perspective? What's successful?
Well, hiring the right person for one thing, which I was fortunate enough to do. But in all seriousness, I would say, I would echo what Lisa said, support. But support means a bunch of things. It means obviously support for him and his area, giving him resources, giving him authority, giving him the attention, support in not just for the position, but for the mission of achieving true equity, diversity, inclusion throughout our organization, which means baking it into everything from our incentive plan to our board education to our new employee orientation and everything else. So I think those are critical. And then visibility in the organization. Demonstrating that we're not just talking about it, but we're actually doing it, and being able to share what we're doing, share when we're succeeding, share when we're not succeeding. And continuing to strive, just like we do with safety, health safety. We want no errors. We want to strive to where we have no disparities. Will we ever get there? I don't know, but we have to make that our goal.
We brought in an external person, and we all had a survey of our unconscious biases. And we were then scored on those, and then we're offered coaching around that for a 3-month period of time, I think. And we were all assigned work to work through our various challenges. And that was really very helpful to then bring that as a weekly sort of conversation.
Part of it is recognizing when the action bias, the kind of typical CEO action bias, is not going to serve you towards an equity end, right? And so I think in some ways, right, so there's a saying, right, in surgeons, it takes 7 years to learn how to do a surgery, and it takes a lifetime to know when not to operate, right? And I think a lot of times with equity work, people see a disparity and there's like, what do we do? And remembering, if you haven't heard from community, if you haven't heard from those most impacted, your instinct of what to do there might make things worse. And so to be able to kind of slow down as a CEO and listen to your chief equity officer when they say, doing right now might not be the thing to do, right? Listening, understanding, and then moving forward is what we need to do. So I think the more CEOs can get comfortable with action isn't always the right thing, even though the discomfort is there that this disparity exists. And then I think in terms of voice, I recognize one thing early on, right? As I said, I'd been in academics and then also practicing as a provider. When I got this role, front of mind for me, I'd been doing research in healthcare disparities and then obviously doing work, I was super happy doing that. So if they don't like what I have to say, I'm going to go back to doing what I was doing before and see patients and do my research. And so I think recognizing that, right, these roles are tremendous privilege, and I'm not going to, underestimate the burden, but there are so many ways that we can advance this work. And if we don't use our voice in this role, there's another place where we can use it and do it. It is always worth speaking the truth.
And I also believe that some of that truth is really recognizing what we do really well, but also not losing focus that we have a long ways to go. There's a lot that we're not doing well. I'll share a little bit. When I came to Alina, I've been in this work for many years. I've been in large organizations, small organizations, corporate. I've seen it from various views. And one of the first conversations I had as I was going through this process, so tell me what it is that you want to achieve. Well, we want someone to come in and tell us, no, what is it that you, as the CEO, as the executive leadership team of this organization, what do you want to achieve? And that led to, oh, okay. So putting it back on the fact that the chief diversity officer can facilitate and do a lot, but it is the C-suite and it's the executive board that makes decisions in terms of where this organization is going. So we had some very candid and honest conversations before I took the job. I was on the phone on Saturday morning having coffee because I was not going to go down this road with this golden dangling carrot. Get into the organization, it's like, oh my gosh, what am I up against, right? So this position started out in an HR role as a director, and within a year and a half, 2 years, elevated to a vice president and chief diversity officer role. I was able to meet the organization where they were, but be able to talk to them about what it is that we want to achieve. This is not an HR thing. This is a system, a priority for those who are making decisions across the organization. So having that ability to say, trust me, to come in with a perspective, with a history of understanding how to navigate this work so that we can get the work done. So trust is really important, but also advocacy. I was a team of one. Many of us started out as a team of one. Now I'm up to 6. We're building infrastructure within the DEI&B department, but also within the context, what I'm calling at Alina, we have a DEI&B ecosystem of accountability. And I call it that because I want to make sure that if we look at this work as everyone's work, not everyone needs to do the same thing. So we have the board engagement, we have the CEO council on DEI&B, we have my team. But as you go down into the organization, we now have a system analytics review committee. This committee comes together and we look at the elements of our scorecard as well as other parts of the organization that's doing the work, and it's a way to bring that visibility to the table. Then it's like, great, at the system level, you have all this work going on. Where it has impact is within the business units, within the hospitals. And so we have 12 different hospitals, and at this point, we have 6 different DEI&B committees that are led at the local level. This work has to resonate with, if I'm at Abbott and we need to focus on recruiting efforts, that might be different for Cambridge, right? But we're trying to create an ecosystem of accountability where everyone is doing the work, but it's also an opportunity to elevate it so the system sees how we're tracking and moving forward.
So I guess I've never been accused of not speaking my mind with Mark. But I will say this, we've been on a journey at Children's too. When I started, the position was a senior director position reporting to our chief medical officer and our general counsel who was responsible for community stuff. And I intentionally said in my head, I was the chief inclusion officer for the state of Minnesota. I reported to the governor, and I'm reporting 3 levels down. I'm not going to fight about it, but I'm going to just do the work. And if they see the work is valuable, the work will show itself. I must commend Mark for seeing that work, and I put on his calendar every 3 weeks we were going to meet. So whether I reported to you or not, I was going to meet with you to tell you what's going on, what are the metrics, what we're doing. And then that led to my position now as part of the C-suite, as part of the SVP. But I think the most important thing about being able to talk is trust. He trusts me to give sound advice around what needs to be done, ask the right questions, and make sure that we're thinking about the right options, just like you trust the CFO. And when I hear the term everybody's work, I admit, equity inclusion is everybody's work. So is finance and budget, but you got a CFO. So is marketing, you got a CMO. So is quality, you got a quality executive of some form. You have to have somebody guiding that work, and that's my role to guide the work and have to be listened to not only from the CEO, but all the executive team and all other people as well. One of the things I told Mark early on was I'm not a physician, and some physicians want to hear from other physicians. So as I build my team, I want to build in some hospitalists, some nurses, some physicians to be advocates, because I don't do surgery and I can't pretend like I know what the biases are, the things that happen there, but I can work with somebody and teach them equity and say, hey, there are questions to ask, and then partner in that way. So as Jackie talked about partnership, those things are the key. But you have to have a strong voice. I hate to say it this way, but there are a lot of people in these jobs that are hurting more than helping because they're not speaking out when they need to speak out. And also they need to, I use the phrase, push your chips in the middle of the table. You don't bet on everything, but sometimes you just gotta push all your chips in. If I get fired tomorrow, I can leave with a clear conscience that I'm doing the right thing for patients, family, and staff, and then we're going to move forward. They're going to move forward in a way that they need to, but I'll move forward with a clear conscience that this is the work that needs to be done. I think more of us need to do that, and also to rely upon each other. These young ladies I talk to on a regular basis on the phone, like, okay, how can you help me with this? How can I help you? How do we partner? Because you need that outlet as well, because this is some tough work. I don't get a chance to turn off. When I leave the hospital, I don't turn off my black and brownness. I go to community, and now I'm dealing with equity in community. When I go to home, I'm dealing with equity there. So it's a consistent 24/7 that I have to gauge how my well-being and self-care is as well before we do this work. So I think it's important that we do all of those things. But trust is really important that we have.
I think that's a great point. And I think one of the things that contributes to that trust, I mean, to have a trusting relationship with someone, you have to be able to be vulnerable with them, right? It can't just be James, I got this. Don't tell me what I'm not doing right. And one of the things that I commend James for, and I don't know that enough leaders do this, but maybe they're not pushed in the same way I am. But James is always encouraging me to explore things, to be in settings where I might be the only white person, to be in, to meet with a variety of people so that I can learn more about the work that we're trying to do from a firsthand point of view, as opposed to just as an intellectual exercise or looking at data. You talk about being uncomfortable. That is another form of being uncomfortable. But that discomfort, that ability to be uncomfortable, is a form of vulnerability that creates the trusting relationship that allows James to say to me whatever's on his mind, and he does. And I value that. That's why he's been so effective.
When I taught in West Africa, there was a phrase in one of the classrooms that, if you want to go fast, go alone. If you want to go far, go together. And I think what I'm hearing in this very rich discussion, and I would say a very unique discussion, because I'm not sure how many times this has actually ever happened, that where I'm hearing and what I'm seeing in the work that we've been able to do at AHA in Minneapolis is I'm seeing you go far. And it's awesome to know that you have these relationships with those bridge builders, because you're building bridges not only in your communities but with each other that will propel the larger ecosystem for its transformation as needed. So on behalf of the American Hospital Association and the Institute for Diversity and Health Equity, thank you all for your commitment to the work, your brilliance and excellence, your leadership, and we'll be back.